There have never been more and better options for women when it comes to birth control. We're not just talking about the pill anymore. But what's right for you at 20 might not be the best option at 30, 40, and beyond. So stick with me because I'm about to give you the ultimate guide to contraception at any stage of life. I'm Dr. Logan Levkoff, and this is Mom Ed in the Bedroom. Hi, thanks for joining me. It can be overwhelming to sift through the number of birth control options available today. But my guest today is going to help us break it all down so that you can make the best informed choices. I'd like to introduce you to my friend, a brilliant doctor and mom of 3, Dr. Jena Wider. Jena, thank you so much for being here.
Thanks for having me, Logan.
Let's break this down. I mean, what is the first thing that women need to know when choosing a contraceptive?
Well, I think women really need to know themselves. They need to know what stage of life they're in. So I like to break it down easily for women and put them into 3 categories. The first category is women who want a temporary birth control, those that are not done having children yet, and those who want to expand their families.
Okay.
So the second category is women who are on the fence. They're not so sure. They might want children, they might not.
And a lot of us find ourselves in that category.
Exactly, so that would be the second category. And the third category is uterus is closed for business, completely 100% done.
I understand that too. Okay, so for that first category of women, women who are still actively growing their family, still want to have more children, what do you think are the best suggestions for them right now?
Okay, so you have several contraceptives in this category, and many of them have hormones. So the first one, by far and away the most popular, is the birth control pill. The birth control pill traditionally is taken for 3 weeks and then you're off for a placebo week. Some of the newer models you take throughout the entire month and then you don't really get a period. So depending on what your preference is. They're all made of hormone, estrogen and progesterone. It's a low dose, configuration. And for some women who get side effects, they may want to talk to their doctor about different brands that might work better for them.
Tell me what this is, because I have a feeling I know where it goes, but it's one of those interesting things. It looks so simple, but
right.
I have a feeling it's not as simple.
No, it doesn't go on your finger. It's not a ring. Right. But it is a ring it's a contraceptive ring that actually fits right there exactly where you put it and women actually put it in themselves right there at the top of the cervix. And it secretes a low dose hormone also, and it's placed in for 3 weeks, and then you take it out for the 4th week. And you don't want to leave it out for more. If it comes out, sometimes it accidentally comes out, you can't leave it out for more than 3 hours. Otherwise, you need a backup birth control method. The patch. The patch is a great option for women who can't remember to take a pill. And that gives you a dose of hormone. You place it once a week on different parts of your body. It can go in your hip. It can go in your hip, it can go in your butt, it can go on your, on your shoulder, on your tummy. You want to change the spot that you put it on each week because it can cause some skin irritation, but it works just the way as the other birth control methods.
But these are all hormonal and need to be discussed.
They are all hormonal.
Symptoms and family histories with doctors.
Right, absolutely, and it's a good point because anytime you put hormones into your body, you get side effects. Women complain of weight gain, they complain of lowered libido, of some breast tenderness, bloating, headaches. So these are common side effects that usually wear off once you get used to the hormone, but if they don't, you need to speak to your doctor.
What about for women who, are concerned about contraceptives but really don't want to use any kind of hormones, or for medical reasons can't use any hormones?
Right, and that's a good point. A lot of women can't use hormones for different reasons. So there are tons of other options, and these are called the barrier methods. And just to mention first, some of them are a diaphragm, a cap, a shield. These are fitted in a doctor's office.
Which cover here, right?
Exactly. They're fitted in the office, you put them in at home, and you have to leave it in 8 hours after having sex. For them to stay totally efficient.
So what about that second category? The I'm on the fence, I'm not sure, I kind of like my life as is, but maybe I'm willing to, throw another kid into the mix.
Right, okay, so in the second category we have the IUD, okay, which is an intrauterine device, that's what it stands for. There are 2 types. First type is made of copper, and the second type releases progestin or progesterone. And that is placed, as you just showed, right there up the cervical canal at the tip of the uterus. And it's placed in with this plastic.
So this is not for home use?
This is not for home use. This needs to be at the doctor's office.
Okay.
And then they pull the plastic sheath off, and it stays there for a long time. The copper one actually lasts 10 to 12 years.
Long-term
protection. But remember, if you decide that you're off the fence and you want to have a family, once it comes out, fertility can be established after 1 month. And for some women, it takes a little bit longer.
So, and let's say I'm done.
Yes.
I'm done having children, shop is closed, and I want a little bit of contraceptive freedom.
Okay, so
what does that mean?
So if you're completely done, there are a lot of different procedures that can happen. The first procedure, the one that I recommend, is for your partner, for the guy. It's called a vasectomy.
I think we should just repeat that. What was that? Who should do it?
The guy.
Okay,
okay. Take one for the team. This is what I said. Women go through enough. It's time for the guy to step up. Okay, a vasectomy is where they snip or cut the vas deferens, which is the tube that goes from the testes to the urethra.
So ejaculate has no sperm in it.
Exactly, no sperm in the ejaculate and you can't get pregnant. This is an outpatient procedure. You can tell your guy it's outpatient. It's done with Novocaine, it's local, and he's out, he's probably complaining, but he's out in a few hours.
Okay.
For a woman to have a tubal ligation, she has to go into the hospital, she's admitted, she needs anesthesia, and it's a to-do. A lot of women do this after they have if they have a C-section and decide they don't want kids. This is a great time to do it.
Because surgery is already taken place.
Surgery has already taken place. There is a new procedure, Logan, that I wanted to mention called E-Sure, where it's done in a doctor's office, and it's done in a pelvic exam. Little tiny coils are put into the fallopian tubes up here, and scar tissue forms around the coil, and it stops fertility that way. And it's no incision, no surgery, and a lot of women are opting to have this procedure now.
And I think that we can't have a conversation about contraceptives and not talk about the humble little condom.
That's right.
Right? I mean,
yes.
And we have male condoms and we have female condoms. And I think it's really important that we talk about them because not every mom out there is partnered. Some are single, some are dating. Condoms are the only things that prevent against sexually transmitted infections.
Absolutely.
And I have to say, I am still a big condom fan and condom user. I mean, they're super convenient. Yep. And I think it's important that we realize that condoms are not just for the young.
No, and I think it's a great point. And I think just adding on to your point, Logan, is the fact that all of these birth control methods do not protect against sexually transmitted diseases. And when you're using a cap, a diaphragm, and a shield, many women unfortunately think that because you're blocking the sperm, you're actually protecting against an STD, but you're not. So if you don't know the history of your partner, if you're not monogamous, it's extremely important to use a condom.
I love when my experience as a sex educator meets my experience as a mom. So let me share with you some of the things that I've learned. If you want to pick the best birth control option for you, make your own personal checklist. And these are the questions you want to ask yourself. Am I having any more kids? How often am I having sex? Do I need or like a routine? Can I remember to take something like the pill every day? Am I concerned about sexually transmitted infections? Do I have a family history of reproductive or breast cancers? Or a history of blood clots? Am I a smoker? Do I want long-term, forget about it for 10 years birth control? Do I want to be hormone-free or am I okay with having hormones? The answers to all of these questions will help you to decide what is the best birth control option for you right now. Jena, thank you so much. This information is so helpful, and I'm sure that you've answered a lot of questions that women have, and probably questions that we don't always talk to our doctors about, but should be. And I want to thank all of you for watching. Did we help you search for your best contraceptive method? Let us know, leave a comment, and don't forget, subscribe to CafeMom Studios on YouTube so you don't miss a single tip and a single episode of Mom Ed in the Bedroom.